Okay, now you've got your client's NeuroGraph results. We need to do something with it. Looking at the screen as we can see it now, you can see that a lot of the scores are very high, and this is not an unusual sort of graph to have produced by somebody who has got a mood disorder problem or several mood disorder problems. So to make it a bit easier to see, what's a good idea is to bring the graphs back as we've discussed in a previous part of the training, so that you can just see 2 or 3 only neurotransmitters in the high. So we'll bring it back by 20%, still too many high. Bring it back by 40%, still too many high. Bring it back by 60, and we're getting somewhere now. We go back again by 70, just a bit tad too far, so we go back to 60 again. There we go. Now, looking at the numbers, we can see GABA, acetylcholine, serotonin and melatonin and adrenaline are in trouble. So now we know that melatonin is made from serotonin, so if we treat the serotonin, one product at a high dose, and the adrenaline, one product at a high dose, and the GABA and the acetylcholine. Now, another thing too that we can also look at too when you're trying to make a decision, you can also click on the serotonin heading and go to the part of the program where you're looking at individual neurotransmitters. And here we can see that the person has answered feeling down and depressed. It's given it 3 points with a frequency of 2. Currently taking antidepressants, maximum, that's either yes or no, which is giving it 4 points. Panic attack, severe anxiety, again, it's got maximum points of both severity and frequency. And if we look further down the page, we can see crave carbohydrates, nervous going into public places, avoiding situations where there's large numbers of people. That's from the moderate importance list, and from the minor importance we've got constipation, but frequent and or long term. Now if we go like to another neurotransmitter which is fairly high, which was GABA, we can see the questions that were answered. So the whole idea of doing this is to get a really good feel and an understanding of what sort of problems you're dealing with these clients and their symptoms. You can go to acetylcholine, so you can go through them and just see what the severity of their condition is, what they're answering, and that allows you to make a much better value judgment as to where you want to go with your treatment. Now, with the areas that we've decided to treat initially, serotonin, which flows of course into melatonin, adrenaline, GABA and acetylcholine, what that's going to do is give us quite a few products. So we're looking here at things like 5-HTP, pre-dope, pre-GABA, paracol, plus the foundation nutrients of activated B3 and cognisense. Now, if you wanted to cut back on the number of nutrients, what you would do is you'd cut out things which were relating to symptoms which were not quite so critical. And that's the whole idea of looking at things like the serotonin, the GABA, etc. So with the serotonin, you're looking at anxiety, you're looking at depression. With GABA, you're looking at anxiety, worry, nervousness, etc. They're the kind of symptoms which are going to be the most discomforting for your client. So if you can make them feel better in those areas, that'll give you time to work on the other areas. So let's take out acetylcholine, click on the drop down on that item and hit the backspace key to wipe it out, and also the adrenaline, and wipe that product out as well. So what it's done now, if you look and see, we've just got 5-HTP, pre-GABA, activated B3 and cognisense. There are 4 products, and sure, it would be nice to just give them 1 or 2, but at least what you're going to do from the very beginning, you are going to alleviate their symptoms, and that's one of the most critical things you can do in clinical practice, is to alleviate the symptoms. Because if you start to make them feel better from the time that they come in, they're more likely to keep coming back to you. Sure, it's important to work on the deeper stuff, and in fact, many times in the past, in my earlier days in practice, I fell for that mistake time and time again, where you look at all their presenting symptoms and their problems, and you go deeply into what the underlying causes are, etc. And you try and do too much too soon. If you gain the patient's confidence by making them feel better, you then have time to work on the deeper stuff and help their health in the long term. Okay, I think something else that needs to be said here, and that is, just say, for example, if you go and look at the symptoms that gave them the high scores for serotonin by clicking on the serotonin button, and here we go, and just say they have problems with thoughts of suicide. And in this case here, the patient's answered 4 points for severity, so in other words, it's quite severe, and the frequencies are 4, so they're thinking about it on a daily basis. So in a case like this, I think it's really critical maybe to bring in, if you're not already a medical doctor, I think it's a very important factor to work, if you're like a naturopath or a psychologist or whatever, work with a doctor, because you may need emergency intervention in a case like this. And even if, for example, the thoughts they've tagged at, say, a 2 and say a 2, whenever a patient is talking about suicidal thoughts, you may have to think about bringing other modalities in, whether it be a GP, a psychiatrist, or whatever. Sometimes you need the extra help, and I found in my own with my own personal experience, there is nothing at all wrong with combining therapies. In other words, sometimes a person may need an antidepressant, they may need some fairly vigorous intervention, and I personally found that sometimes, in my case particularly, I found that things work much better when I use combinational therapies, both antidepressants as well as nutritional medicines. And in fact, going back into 2006, I came down with the flu, didn't do anything about it, typical naturopath, and didn't go to my mate the doctor, didn't get antibiotics. And after 2 weeks, I finished up in the Royal Brisbane Hospital on a drip with a partly collapsed left lung. That then triggered major depression. So I then finished up for the next 14 months in private hospitals on massive doses of antidepressants like Effexor for 600 milligrams. I was also on Zyprexa and Avanza. They didn't do a whole lot until eventually, after 14 months, I was given ECT. I think it was about 15 to 20 sessions of ECT. That got me out of the hole that I was in. I started to feel normal again. I was released from hospital, but I started to go backwards, started to regress after about 3 months. And then my psychiatrist said, "Oh, look, Mike, you might need to have more ECT, you might need to change your meds." That's when I got off my butt. And luckily by that stage, my brain was still working quite well. I did a lot of research. And as a result of the research that I did, I was able to go into nutrients, which helped me to get back to full mental health and happiness again. And hand in hand with my psychiatrist, we weaned me off the antidepressants. At the same time, I was maintaining my nutritional medicine supplements, including 5-HTP, activated B3, SEMI, and so forth. And I know it has been said that you should never take antidepressants with 5-HTP, and should never take antidepressants with SEMI. But in this program that you've got, there's a very good article which you should read. It talks about 5-HTP facts and fictions. So in my own case, I thought, well, it's either going to be kill or cure, because I wasn't going to go back to the emotional state that I was in, and fortunately for me, it was a cure. And I've had other practitioners who are using the crossover method of putting people onto nutritional medicines, and as they improved in conjunction with their doctor, the medications can be brought back. And sometimes too, you may even need to maintain an antidepressant, but there's no reason why you can't give the nutritional support, because one of the problems about taking an SSRI, for example, or even an SNRI, selective serotonin reuptake inhibitor, or serotonin and noradrenaline reuptake inhibitors, the problem with them is that that assumes you are making enough, say, noradrenaline or serotonin to begin with. But what if you're not? And in my case, I wasn't. And it wasn't until I put things in the front end that stuff in the back end started working. And that's why I was taking things like 5-HTP, activated B3, etc. And if you would like a copy of the ebook, I think it's around about 90 pages, including all the scientific articles and references I have in there, please let me know, and I'll just email you a link so that you can download that article. If you would like any support when you first start using the program, particularly help in interpreting the graph, the NeuroGraph, well, please don't hesitate to call me. What we can do is I can give you remote support using a program called TeamViewer, where I can actually walk you through the process, particularly for the first couple that you are doing, of getting you started with it and using it efficiently. So please don't hesitate to call me. My number here is 0732647945. That's 0732647945.